Welcome, everyone. Thank you so much for joining us. We're just going to hold on a minute here while our platform's letting everyone in. But in the meantime, feel free to go into our chat and give us a greeting. Let us know where you're tuning in from today. We would love to hear from you. Welcome, welcome. Thank you so much, everyone, for joining us. We are just holding off while our platform's letting everyone in. We will begin shortly. But as I can see from the chat, you are all introducing yourselves. We love to see that. So please hop in there, give us a greeting, let us know where you're tuning in from today, and say hello to the others joining. Wonderful. Looks like we have folks from all over here with us today. We encourage you to continue using the chat throughout today's session. So feel free to connect, make comments, and ask questions in there. All right, well, it looks like our numbers are slowing down a little bit for those joining. So we're gonna go ahead and get started. Hi, everyone. Thank you so much for joining us and welcome to today's webinar, Serving an Underserved Population, Peer Support, Disability, and Mental Health. My name is Jackie Zimmerman. I'm the Public Education Associate at Mental Health America's National Office, and I'll be moderating today's webinar. I have a few notes for you all before I introduce our speaker today. This webinar is being recorded and will be emailed out to all participants within 1 week. We currently do not offer CEUs, but if you would like to request a certificate of attendance, I have a link for you to fill out a form to do so. I will post that in the chat here shortly, and it will also be included in your follow-up materials. We do plan to have some time at the end of our session today for Q&A with our speakers. So if you have a question throughout the presentation today, please feel free to post that in the chat, and I will be collecting those as we go through, and we'll have some time to answer some of your questions at the end of today's session. And now I am so thrilled to introduce our panelist for today, Amy Wright. Amy has worked with the Mental Health America of the Heartland in Kansas City area for more than 2 years. She started out as a wellness and support advocate for a developmental disability provider in the Kansas City metro region, with people who have a dual diagnosis of intellectual and developmental disability and mental health. Currently, she's the manager of advocacy and recovery services at Mental Health America of Heartland. Amy's been active on several area committees and organizations, including the Mobility Advisory Committee through the Mid-America Regional Council in the Kansas City metro region. Additionally, Amy has sensory disabilities and lived experience with mental illness. Thank you for joining us here today, Amy. We are so excited to have you and grateful for your time shared with us. I will hand it over to you and let you take it away.
Thank you, Jackie. Good afternoon, or I guess it's good morning for people on the West Coast. So wherever you are, welcome. And let's go ahead and get started. So today we're going to be talking about serving an underserved population with peer support, disability, and mental health. Adults with disabilities reported mental distress 4.6 times as often as those without disabilities. And here we can see the significance of the problem of mental health and disabilities. Veterans with disabilities are 20% less likely to report mental distress as veterans without disabilities. That's significant because that tells us that veterans are less likely to speak up when they are experiencing mental health symptoms. As we can see by the definition of disability, having a physical or mental impairment that limits a major life activity, a person who has a history of such an impairment, or a person who is perceived as by others as having an impairment. That comes from the Americans with Disabilities Act that President George H.W. Bush signed into law in 1990. This was a significant landmark policy and law to improve the lives of people who have disabilities. And then under the Centers for Disease Control, defines disability as any condition of the body or mind, an impairment that makes it more difficult for people to do certain activities or fully participate in the activities of daily life. The focus today is on the cognitive, sensory, and physical impairments that some people with mental illness also have. So, for example, people who have intellectual and developmental disabilities or significant impairments in that area, say autism or Down syndrome, things like that. So we're going to talk about the first steps in helping a peer to cope with a mental health diagnosis. There are several things that we can do as peers to help these people to be able to cope. How to help? The first thing we want to do is encourage the peer to get an appointment with their primary care doctor to get a full physical exam, including blood work. And other evaluations may also be needed, such as vision and hearing. And the reason for that is that there is a long list of medical conditions that can look like mental health is mental illness on the outside, but they're really not. They're actually physical conditions that can be helped with other things. But when talking to the peer, we want to use active listening skills, such as paraphrase and reflection of feeling. And paraphrase is saying in your own words back to the peer what you think you heard them say. This helps them to feel heard and to feel like they are understood. As Stephen Covey used to say, seek first to understand and then to be understood. And this falls really neatly into that. The reflection of feeling is talking to the peer about how they're feeling about what they had just said. They're so frustrated that the building that they're trying to get into has a bunch of stairways to get to the entrance, but they use a wheelchair and there's no ramp. Oh, you must be really frustrated by this setup. This must be really frustrating to you, and it must make you sad to not be able to participate. The third thing we want to do is help the peer to prioritize their concerns. Helping the peer to prioritize their concerns can look like, okay, so they want to be independent, but they are experiencing significant symptoms of mental health, such as they're really tired and they can hardly get out of bed in the morning, or they may report that they're hearing things that may not be there. Independence is a worthwhile goal, but managing these symptoms may be a more immediate concern. So when we're talking about helping, next is navigating the system. The system is not, can be not very friendly to people who have disabilities. A lot of therapists do not take Medicaid, and a lot of therapists are only taking private pay because it is really hard to get in network with an insurance company. So that said, the first thing we want to do is encourage the peer to call the customer service phone number on the back of their insurance card and get an in-network list. But then we also want to call the therapist or the psychiatrist on that list to make sure that the office that they're going to is accessible. Is there an elevator? Is there a wheelchair ramp? Is there a sign language interpreter for someone who has a hearing impairment and may use sign language? Can they provide large print directions or large print versions of patient information? And then community mental health centers are a great place to start with Medicaid, but they can also, you can also run into waiting lists because they are understaffed, and also where you can go may depend on your address, because the mental health centers are set up by catchment areas, which means that they have kind of a territory of where of who they serve. There is a 5-stage recovery process for mental health. And this came from the Appalachian Consulting Group, the Peer Specialist and Peer Support Participation Manual. And this is something that peer support specialists see when they are in training. The first stage is stage 1, the impact of the illness. Here, the peer is so overwhelmed by the power of the mental illness that they are unable to function day to day. They may have. So how we can help is to provide encouragement, help reduce mental distress, help reduce symptoms, and instill a sense of hope that there is life beyond diagnosis. Here we may want, this may be more difficult for people who have disabilities, because a lot of people who have disabilities have been bullied as kids on the playground, maybe at recess at school or in the neighborhood. As an example, when I was a child in elementary school, some of the kids in the class would put me in the middle of a circle and then make a big circle around me, and they'll yell and point to me, 4 eyes, 4 eyes. Well, the rest of that story is I got back at them in 5th grade after I got my first hearing aid, and I said, yeah, now I have 4 ears too. Never heard anything more about 4 eyes after that. But these are the kinds of things that people with disabilities may have had to deal with as children. And then as they became adults, they may have had people in their life tell them that they can't do this and can't do that because of their disability. For example, I had a gentleman that I worked with about a couple years ago who seemed to be very intelligent to me, but he had a diagnosis of autism and some kind of intellectual disability. He had a challenge with running out of money at the cash register. Well, it turns out that he didn't know about sales tax. And so I was able to teach him about sales tax, and he caught on very quickly. But then he told me that no one had ever taken the time to teach him anything because people had thought that he couldn't do anything because of his disability. He told me that I was the first person who ever told him that he could do something. And you may be the first person to tell your peers that they can do something or to believe in them. Oops. The second stage of the recovery process is life is limited. Here they have given in to the disabling power of the illness, and the danger in that is that they give up in accepting a limited life, that they accepting that they are limited in what they can do because of their disability and their mental health, those two combined. The person also does not realize there's anything they can do to improve their life. And so what we can do at this stage is instill hope and a sense of possibility. And here it might be a good idea to research well-known people who have the disabilities that the peer has. For example, Edgar Allan Poe is thought to have had a mental illness. And that when I found that out, that brought a whole new sense of meaning to his writing. And also Abraham Lincoln. He may have had a mental illness and maybe a physical disability, but he also was president of the United States. Helen Keller was a well-known activist, but she was also deaf and blind. These are some examples, and there are many more out there. Stevie Wonder was blind, but he is a singer, a well-known singer. Anyway, some of another example is someone I know who has some kind of cerebral palsy and uses a wheelchair, but she is very intelligent. She has an MSW and uses accommodations on her computer at work. Stage 3 is changes possible, characterized by questioning the disabling power of the mental health, of the mental illness. The danger is that they are afraid or discouraged from taking necessary risks to change their life. And here again is the possibility that the peer has been told that they can't do anything, or that they were bullied and teased to the point that they no longer believed that they could do anything, or that their self-esteem was really low. And the other danger is that they stay in the life as limited stage. What we can do as peer support specialists is help the person to see that they are not as limited by their mental illness, and help the peer to see that in order to make things better, they will have to take some risks and get out of their comfort zone. Just living is a risk. But what this could look like with someone with a disability is maybe they need to learn some new skills. Maybe they weren't taught as children how to use low vision aids so that they could see the books or the printed materials that they are reading. Maybe they weren't taught at a young age to say, I can't hear from the back row. May I sit up at the front where I can hear better? Or to say, this print is too small. May I have a larger print copy? The peer may need help with basic advocacy skills. And here is where we can work with them on basic communication skills, helping them to be able to communicate their needs to the people that they need to communicate with. Stage 4. Whoops, is commitment to change. Here, they are challenging the disabling power of their mental illness and maybe their other disability that they have as well. The danger here is that the person does not learn necessary skills or have the access to the resources and support they need in order to move forward, or the person does not succeed. Here, the lack of resources, not having access to the resources and support they need can look like is, I want to get a full-time job or even just a part-time job, but I can't get there from here because there is no transportation in my area and I can't drive. Here is where some system change can be helpful for our peers to have disabilities and mental health issues, and helping to advocate with the local organizations. Like in Kansas City, we have the Kansas City Area Transportation Authority. And in the area of the city where I live in, the city county has their own transportation. As an example of the transportation, when I started with the Mobility Advisory Committee 8 years ago, there was nothing that crossed state or county lines. Now there is. There's been a lot of changes. There's still a lot of work to do, but there have been a lot of changes, and now people can get around a lot easier. Limited skill set can also look like limited communication ability in people who have intellectual or developmental disabilities, and hearing impairments too. Limited knowledge on how to use adaptive equipment in people who have low vision, and limited communication. Yeah, okay. Limited communication skills can be helped by helping the peer to put what they're feeling into words. For example, if they are using a wheelchair and there's a lot of steps to get up to the entrance, maybe they need to call someone in the building and say, is there a wheelchair ramp? But this may be a little harder with people who have disabilities because some mental illnesses cause information processing speeds to slow down. And with people who have intellectual and developmental disabilities, their information processing speed is already slowed down. So if they also have depression or schizophrenia or anything else like that, their processing speed is going to be even slower. Stage 5 in the process is action to change, characterized by moving beyond the disabling power of the mental illness. And the danger here is that they begin to doubt their ability to function on their own as they've started learning new skills. And it's possible that they have never functioned on their own. That's always a possibility. I once knew someone who had always lived at home with a parent who helped them with everything, but then when was time for them to become independent, they didn't when it was time for them to become independent, they began doubting themselves. So what we can do to help support them is to help the peer to trust their own decisions and help the peer to take more and more responsibility for their life. And taking the responsibility is a big step, but it may be more difficult for people who have disabilities because they have not been because some people have not been able to be that independent. This next slide shows the Transtheoretical model of behavior change of Prochaska and DiClemente. As you can see here, these 6 steps also correspond with these 5 stages of the recovery process. Now there's a 6th one in this one in the there's a relapse step, but let's start at the top in pre-contemplation. They have no intention of changing their behavior. They are unaware. This corresponds to stage 1 of life is limited. The impact of the illness. Here, we can just help them to raise awareness that there are things that they can do to help improve their life. But this whole process of behavior change, again, may take a little longer with people who have disabilities, especially people who have intellectual and developmental disabilities, because of their possible slower processing speed. In the contemplation stage, people are aware of the problem, but there is really no commitment to action yet. They're just still thinking about it. They're still thinking about changing. Excuse me. This can correspond to stage 2, the life is limited stage of the 5-stage recovery model. Stage 2, and then stage 3, preparation, where they are intent on taking action, but they're not quite ready. They're in that preparation stage. And what that can look like with people who have disabilities is that maybe they're in the process of getting the tools that they need to succeed. Maybe they're in the process of getting on SSI or getting that part-time job that they want or getting that transportation that they need. Then there's the action stage, which really jumps ahead to stage 5 of the 5-stage recovery model. And that's where they are actively modifying their behavior. And this can look like, okay, I need to learn how to budget. So I am actively engaging in learning how to budget. Maybe I'm working with a peer specialist to learn how to budget. Or maybe I've got someone else who is teaching me how to budget. And then we have the maintenance stage, which is just helping the peer to maintain the changes that they have made. But the big challenge comes with relapse in stage 6. Relapse is where they have gone all the way back to stage 1 and they may have given up at this point. Instead, what's the use if I can't maintain the change? Then it's no use. But a peer specialist can come in and say, yeah, you've done it once before. Let's see what went wrong and see how we can help you to get back on track. For example, in the budgeting example, maybe they went over their budget one month and they are feeling like they weren't really that successful. Well, that was only 1 month. So what went wrong? Where did they spend a little too much money, or what happened that made them go over budget? Was it an unexpected medical bill? Or was it that they bought too many, they ate out too many times? Those have different, solving those two problems is different. So here we can see that there are ways that we can help a peer who also has a disability to who also has a disability and a mental illness to say, if they have, for example, okay, never mind. So what questions do we have?
Thank you, Amy. I have one question to start us off from the chat. That one is, it was towards the beginning of your presentation, and someone asked, can you give some specific examples of mental health symptoms that could be misdiagnosed as potential physical disabilities?
Okay. For example, lack of social interaction or with social withdrawal can possibly be a hearing impairment, because, or a vision impairment even, because they're not getting all the signals. And I know that as a person who has a vision impairment and a hearing impairment, both, I don't pick up all the signals all the time. And so sometimes when I'm one-on-one, I act completely differently than I do in a crowd, because in a crowd it's just loud and noisy and there's just so much to keep track of. I'm just not picking up everything that's going on. So that's one thing. That's the main one I can think of off the top of my head.
That's a great one. I saw in the chat too, someone had mentioned that in their experience, mental health issues are physically exhausting too. So depression
Yes.
can look like chronic fatigue, etc. So thank you, Chris, for that comment. That's a good one as well. Another question that we had come through Is it possible to develop peer programs for specific diagnoses or conditions, examples TBI or autism, that will qualify for reimbursement under CMS and other private insurers?
I had not even thought of that, to be honest with you, but I think that's a great idea.
Yeah, absolutely. Definitely an area that can be looked into and advocated for, because that would be wonderful.
Can we put some of these like in an email or something so that like a follow-up email?
Yeah, absolutely. Any of the questions that are put in here, I can send as a follow-up to Amy, and then we can send responses to all of you in the follow-up that our registrants receive.
But yeah, go ahead. What's the next one?
One that we had earlier, and a few people put in some really great resources, but someone was asking about specific resources for teaching sign language. For those who have limited hearing skills, is there a program that you would recommend, or resources that you would recommend for teaching sign language? Someone, go ahead.
Go ahead. There are two things that come to my mind. First of all, contact the Helen Keller National Center. They're an organization that works with people who have hearing impairments, vision impairments, both, especially both. They may know where to find the sign language resources in your area. Another thing to consider is Centers for Independent Living. Here in town, we have a Center for Independent Living, the whole person, that does sign language classes. And they have new ones starting all the time. So that's another resource. Those are the two main ones that I can think of.
Absolutely. Thank you. And I see a few other individuals sharing some of the resources they know of. So thank you all for your input there. Another question we had come through addresses that mental health issues and I want to make sure that we are clearly addressing this one. Mental health issues in the church are limited. How can the church help? So I think this individual is wondering, how can outside organizations such as churches or other community-based organizations help individuals that have mental illness and disability?
That's also a really good question, because there are still some religious organizations, and I'm just going to say some, because not everyone is like this, that still believe that mental illness is not really biologically based. They believe that it is spiritually based. And there we can just, I think education is key.
Yeah.
To helping them to understand that this is biologically based, and therefore it needs a medical response. But as far as helping people, I think that's a starting point, is realizing that this is biologically based, it needs medical help. And then just providing those supports for people who have disabilities. Like, say, for example, the Sunday morning sermons, providing a transcript of the sermon for people who have hearing impairments, or providing a sign language interpreter, or large print music that people can use to when they sing the songs.
Absolutely. Those are some great suggestions. Another question that came in, thank you all for the really great questions. This individual asked, how can employers support individuals with disabilities and mental health issues?
How can a what?
An employer.
Oh,
Help.
an employer.
Yep.
Oh, that's another great one. One of the things that I have seen is that a lot of employers, and I'm talking about outside the mental health organization, America organization, expect people to be able to do absolutely everything. And maybe that doesn't need to happen all the time. Maybe some tweaks can be made so that in a retail environment, someone who has a vision impairment doesn't need to run the cash register because the print is so small, or they have to read the small barcodes on something to key something in by hand. Or let them have a powerful magnifier up there to be able to key things in, and not expect that they're going to be able to get people through the line at a very fast speed. Other things that can be done is in the Americans with Disabilities Act, there are provisions in there for that employers have to make reasonable accommodations. And that is where advocacy can be so key for the people who, for the employees, to advocate for needing a magnifier or needing a sign language interpreter or whatever they need, or different software on their computer. Those are some things I can think of off the top of my head.
Yeah, absolutely. Those are some great suggestions. Those accommodations are so important and can be really helpful. I'm going to put one resource in the chat that is a workplace mental health toolkit that our national office has put out that has some helpful tips for employees and employers who have mental illness, that it just talks through how you can support individuals with a mental health condition in the workplace. So that can be a helpful resource. I want to follow up on that question with you, Amy.
Yes.
What in your personal experience have been the most beneficial accommodations that employers have made for you?
I would say probably, because I haven't had that many employers in my life, but I would say just letting me have my magnifiers. And another thing too is when I worked retail, I had a hearing aid that was controlled by my cell phone. And it was we had a no cell phone on the sales floor policy. And they made an ADA exception for me to have my cell phone with me so that if I needed to hear a customer, I could hear them with I could turn my cell phone up or down or whatever I needed to do with it. Other things are to let me have different software on my computer if I need it. Or, now you have Dell computers that have every accommodation that you can think of just built right into them, universal design. Those are just some examples of some things.
Absolutely. Those are all great. And I think one easy thing that employers can do is just to ask the individual, what would
exactly be yeah, what do you need?
Yeah, absolutely. And each person's needs can vary. And as long as employers are accommodating to that individual's needs, it will go a long way. And so
Yes.
as an employer, you should be asking your employees, what can we do and how can this be easier for you, so that that eliminates the stress on the job of those potential barriers for the individual.
And I think it brings in more business, especially in service industries. If they see people that see a diverse workforce working there.
Mm-hmm. Absolutely. That kind of ties into another comment that was made in the chat by someone who said, so many times the peers I work with don't want to let their employer know they have a disability. They think they won't get hired. And I think this is true for those who have disability and who also have mental health conditions. Is there's that stigma and that
Yes.
fear of, if you talk about it to an employer, I won't get hired, or I could get fired, or I won't be allowed to do certain tasks. How can we start to address that stigma within these communities?
That is a really good question and a really good point. I think first of all, education.
Mm-hmm.
Education and exposure to people who have disabilities, because there's still a lot of people out there that think I'm getting ready to say something that's not going to come across the way that I want it to come across, but I can't think of another way to say it. They think that disability means less than, and that's not the case at all. People who have disabilities are very resourceful. They are very creative. They're hardworking. For example, someone who may use a wheelchair, and they may not be, I knew a person who used a wheelchair, but he was great with computers and caught a university-wide security leak on campus at University of Nebraska, and called people up and said, you need to look into this. And he was right.
Yeah, absolutely. I think breaking that stigma is such an important piece of this. And you're completely right. Education is needed, and just
Yeah.
educating at all levels in the workplace and just in our communities
Yes.
of what it really means for individuals who have disabilities or that struggle with a mental health condition, and that they are still extremely capable individuals within our society that have so many talents and qualities to share. And so really just figuring out how to best utilize those qualities and provide the accommodations they need is so important. And that shouldn't be a reason for an employee to not get hired, or to have that fear of sharing that with their employer. And so as difficult as it is, and is still so prevalent because so many do have that fear, if they share that with an employer, or if they share that with individuals, it is so important to be able to share that so that we can start to break down that stigma.
I tell people with my hearing impairment that I prefer that people know up front that I have a hearing impairment, because I have no very limited, if any, ability at all to figure out which direction sound is coming from. So if someone's trying to get my attention from down the hall and I'm sitting there looking like a chicken with its head cut off, I'm not being rude. I just don't know where the sound is coming from.
Right. Absolutely. And I think that connects to another question that was added in the chat. And this one's interesting because it is hard when these are personal details about one's life, and really it is your choice to share or not share those things you have going on. I am someone who lives with anxiety and has struggled with depression and eating disorders, but others in the same situation might not feel comfortable to share that with others. And this individual had said that they worked at a job where they did not know that their coworker was on the autism spectrum. And when they inquired about certain responses to situations that seemed strange to them, their employer shared that that individual has a learning disability. they were surprised and weren't sure why they weren't made aware of this. Do you think it's important for colleagues to know if someone has a disability so that they can best support that individual?
I think that's up to the individual. Do they
Mhm.
want like I do want people to know about my vision and hearing challenges, but other people, that may not be their choice. So I think it's up to the individuals whether they want to disclose or not.
Absolutely, yes, and that's kind of where I was leading with my intro to that as myself too. And even a few years ago, I probably wouldn't have the courage to say that on a platform like this. And
Mhm.
so it really is personal, and that still is personal health information. And so it is completely up to the individual and how much they would like to share. But just being understanding as a coworker and as a colleague and as a community member that someone's needs might be different than yours, and there might be an intention behind their behavior that isn't apparent to the eye. And so just always approaching situations with that lens and knowing that others might have different needs than your own, and so keeping that in mind in those situations. I do have one more question that came through that says, how best can one help peers struggling with mental health issues, but somehow are in denial of it?
Oh, that is so tough. I would say probably to help, I would encourage them to listen to what other people are saying about their behavior, other people around them are saying about their behavior, because that could give them some clues. Maybe and maybe not. Maybe it's part of their mental illness that they lack that insight.
Mhm.
I don't know. That's a tough one.
Yeah, it's very challenging, and a lot of times, you hear the saying of you have to be open to help to receive help, and it's challenging in these situations with mental health conditions because there's still a variety of reasons why someone might not admit that they're struggling. And one of those, like we talked about before, that stigma around it, feeling embarrassed or ashamed, and a lot of times that's affected by culture too. And whether you feel comfortable admitting that and receiving that help. And so I loved what someone put in the chat that said modeling honest communication. And that's really a great point, is that if you model in your conversations that it's okay that you share how you feel and maybe you're more open and vulnerable with that individual, they'll feel more comfortable to really share what's going on and what they might be struggling with or what challenges they might have. So just continue to be that peer support, continue to listen to them in an open and compassionate and honest way, so that if there is a time where they feel comfortable sharing that with you and asking for help, they can do so in that safe space. I'm just checking the chat. Um, I'm not sure if we have any other questions coming through. I see a lot of comments, which I appreciate you all sharing your comments and knowledge on these questions coming through as well. I know that a lot of you have great experience and are sharing those experiences as well. So thank you all. For anyone who's been communicating throughout the chat, asking questions, and also sharing resources in there. I know there have been some great ones shared. I'm just checking through to make sure we didn't miss anything in here, but I think that was all of our questions that came through. So I will close this out here then today. Um, I just want to remind everyone that we'll be sending out a follow-up email with the link to the recording from today, as well as the slides. I know a few of you were inquiring about if you would have the slides afterwards. We can send those out for you to share as well. And all of the questions that were raised in the chat too, we will make a list of, and if there's any follow-up that Amy wants to put out for those questions, we'll send you any of those answers as well. So we appreciate you all so much for being here today, for participating, and for all your wonderful questions and resources shared. And a really big thank you to Amy for spending the time here today with us and putting together such a wonderful presentation for the group. All right, thank you. I see all of the great thank yous in the chat. Have a wonderful rest of your afternoon, everyone, and thank you so much, Amy.
Thank you.
All right, have a great day.
You too.